Hey guys, I'm going to go over the setup for catheter placement when a catheter is being placed in PACU or ICU. So first of all, the anesthesiologist will assess the patient on the floor and obtain consent. The anesthesia consent is the only consent that you will need for the procedure. Okay. They will then work with the charge nurse to figure out a time for the block and assign a block nurse. The block nurse will need to get a couple of things together for the procedure. The first will be the ultrasound and then also the block cart, and you can get these from Holding. You'll also need a bedside table for anesthesia and possibly a second for positioning of the patient. If the catheter is going to be done in PACU, a focus report will be obtained by the nurse and 2 people will transport the patient from their room in a bed to PACU. On arrival to PACU, notify the doctor that the patient is here. Follow the tip sheet for documentation and checking in the patient. If you need any help with this, you can use the F1 function in Epic. Also, the patient should be hooked up to the monitor with the blood pressure cuff cycling every 5 minutes. Oxygen should be placed on the patient at 2 liters nasal cannula and starting the IV fluids. You want to then check Epic for 2 orders. The first being ropivacaine, and you can release that order. The second is for ultrasound guidance by anesthesia. This order is very important because that is how you can bring up the patient information on the ultrasound. If it is not there, the nurse can place the order per our protocol. Now with the ultrasound machine, when you do get it, if you need to turn it on, the on button is located on the back top right corner. It does take a minute for it to start warming up and the touch screen to become available. Once you have it all warmed up, you can press patient and then information, and this will bring you up to the screen where you can then locate the patient by typing in the first 3 letters of the patient's last name and then clicking OK. Pressing query will then bring up the patient information on there and you'll select the patient. The other important step is to make sure that this is on the nerve block. It is the default setting, so you just want to make sure that it's on the nerve setting. Once you've clicked on the patient, you can click done, and the patient's information will be displayed on the top of the board here. Make sure that it is the correct patient information that's there. Other features on here that you'll be asked by the anesthesiologist to perform are increasing or decreasing the gain and the depth. And these knobs are labeled here on the ultrasound machine. Gain on the left and on the right is depth. During the procedure, anesthesia may also ask you to take a picture, and for that you will press the camera button located on the screen here. When the procedure is all finished, you're going to go back to patient information, click end, then done. This will then send all of the information to the computer system. For the setup of the procedure, you're going to check the laterality. So if it's an extremity, you'll check the extremity laterality, and on the surgical side is where the anesthesiologist will be. For rib fractures, you're going to want to check the laterality with the anesthesiologist. For the procedure, you're going to set the bedside table next to the anesthesiologist on the operative side, with the block cart being at the end of the bed. Make sure to go through and familiarize yourself with the block cart, because during the procedure you may be asked to get something for anesthesia and using a sterile technique, place it into the field for them. On the opposite side of the stretcher, the nurse will be standing with the ultrasound on the opposite side of the bed. For rib fractures, there are a couple positions that we will place the patient in. It's the most common being sitting on the side of the bed or on a lateral position, and this is up to the anesthesiologist's preference, and it's the nurse's responsibility to position the patient for the procedure. Once anesthesia has gotten their stuff out of the cart and they are all set up for the procedure, you'll perform the timeout. Make sure that you take note of the time that you are performing the timeout so you can document it in the computer. And that is the setup for the catheter placement in PACU.